What you're about to learn could completely change the way you think about the blood pressure medication sitting on your shelf right now. If you're taking amlodipine, losartan, or lisinopril, there is a good chance that a symptom you've been blaming on aging, stress, poor sleep, or simply having an off day may actually be your body's way of telling you that your medication is affecting you in ways nobody fully explained. That's what concerns me most. These medications don't only create problems when they're prescribed incorrectly. Trouble often starts when people don't understand how the medication works inside their body. They miss the warning signs, dismiss important symptoms, and sometimes don't realize what's happening until a serious issue develops. Before we continue, make sure you subscribe to Wellness Science Hub so you never miss practical health information that could help protect your well-being. If you've been prescribed amlodipine, losartan, or lisinopril to manage high blood pressure, there are 11 important things you should know. Not because anyone is intentionally keeping information from you, but because medical appointments are often short, explanations can feel rushed, and many patients leave with a prescription but without a complete understanding of what to expect. By the end of this video, you'll know which side effects are relatively common, which ones require immediate attention, and which seemingly harmless symptoms may deserve a closer look. Most importantly, you'll understand a truth that goes far beyond the numbers on your blood pressure monitor. Long-term success depends not only on lowering blood pressure, but also on safely staying on treatment. Let me tell you about Gloria because her experience perfectly illustrates why this conversation matters. Gloria was 72 years old, highly organized, and incredibly responsible when it came to her health. She never missed a dose, followed every instruction carefully, and attended every scheduled appointment. On paper, everything looked excellent. Her blood pressure readings improved exactly as expected. But a few months later, she came into my office with a concern. Her shoes felt tighter. By the end of the day, her ankles were noticeably swollen, and she felt unusually heavy and uncomfortable. She thought she might be gaining weight. Her daughter worried there could be a heart problem. Gloria was frightened. What nobody had clearly explained was that the same medication helping her blood pressure could also produce a specific side effect that often gets mistaken for something much more serious. That brings us to number 11. One of the biggest misunderstandings about blood pressure medication is the assumption that these drugs are basically the same. They're not. Amlodipine belongs to a group called calcium channel blockers. Losartan is an ARB, or angiotensin receptor blocker. Lisinopril is an ACE inhibitor. While all three are designed to lower blood pressure, they accomplish that goal through completely different mechanisms. Because of that, they also create very different side effect patterns. If you don't understand those differences, it's easy to misinterpret what your body is trying to tell you. Amlodipine commonly causes swelling in the lower legs and ankles. Lisinopril is well known for causing a persistent dry cough. Losartan is often prescribed as an alternative when someone cannot tolerate that cough. Same purpose, different pathway, different side effects. And this distinction is more important than many people realize. Someone who develops a cough while taking lisinopril may wrongly assume all blood pressure medications will cause the same problem and stop treatment entirely. Someone experiencing swelling from amlodipine may fear heart failure when that's not actually the cause. Another person taking losartan may feel perfectly fine and assume there's nothing to monitor, even though changes in potassium levels can sometimes occur quietly without obvious symptoms. The key lesson is simple. The name of your medication matters because it tells you what class of drug you're taking, and that class often predicts the side effects you're most likely to experience. When you understand those patterns, you're less likely to be caught off guard, and when you're not surprised by symptoms, you're more likely to make informed decisions before a minor issue becomes a major one. Now let's talk about number 10, the issue Gloria was experiencing without realizing it. Amlodipine can cause swelling in the ankles and lower legs, and this is one of the most commonly misunderstood side effects of blood pressure treatment. Many people assume they've eaten too much salt. Others think their kidneys aren't working properly. Some worry they're becoming less active or gaining weight. But in many cases, the medication itself is responsible. Amlodipine relaxes small arteries more than veins. As a result, blood can flow into the legs more easily than it flows back out. Pressure builds inside tiny blood vessels, allowing fluid to leak into surrounding tissues. That's why people often notice that their ankles look normal in the morning but become swollen by evening. Arthur experienced exactly this situation. At 76 years old, he noticed his ankles becoming larger as the day went on. He assumed it was simply part of aging. When he elevated his legs at night, the swelling improved by morning, only to return later in the day. He never considered that the amlodipine he had started several weeks earlier might be responsible. The real problem wasn't just the swelling, it was that he never discussed it. He didn't want to bother his doctor. As the swelling worsened, he became increasingly uncomfortable. Eventually, he started skipping doses on days when he planned to leave the house because he felt self-conscious about the appearance of his legs. That's how a manageable side effect can lead to uncontrolled blood pressure. Swelling doesn't automatically mean the medication is wrong for you, but it does mean it's time for a conversation with your healthcare provider. Now let's move to number 9. Lisinopril can cause a persistent dry cough, and this side effect often gets overlooked because it doesn't always appear immediately. Some people develop it within days, others may not notice it for weeks or even months. Because of this delay, many patients never connect the symptom to their medication. Instead, they blame seasonal allergies, dust, reflux, lingering colds, or dry air. The cough is usually dry, irritating, and stubborn. It doesn't typically produce mucus. It isn't dramatic. It's simply persistent. Since it often becomes more noticeable at night, many people assume the problem is related to their lungs or breathing when the actual cause may be the pill they've been taking every morning. Helen learned this firsthand. 4 months after beginning lisinopril, she developed a constant tickling sensation in her throat. Soon afterward came frequent nighttime coughing episodes. Her sleep suffered. Her energy levels dropped. Every morning she woke up feeling exhausted. She assumed age was catching up with her, or that her acid reflux had returned. She tried throat lozenges, changed household products, and even replaced her home's air filter. Nothing worked. When we reviewed her medication history and compared it to when the cough started, everything suddenly made sense. She had never been told that a lisinopril-related cough can appear months after treatment begins. Unfortunately, many people tolerate this symptom for months before seeking help. Some eventually stop taking their medication without telling anyone, which can create even greater health risks. But there's another point that is even more important. A dry cough caused by lisinopril is usually very different from a true medical emergency. The symptom that requires immediate attention is swelling involving the lips, tongue, face, or throat, especially if it affects breathing or swallowing. That is not something to monitor at home. That is not something to wait until next week to discuss. That requires urgent medical care. In rare situations, ACE inhibitors such as lisinopril can trigger a condition called angioedema. When it occurs, it can become dangerous very quickly. Similar reactions have occasionally been reported with ARBs like losartan, but ACE inhibitors are the medications most commonly associated with this concern. So remember the difference. A cough may be uncomfortable and frustrating, but swelling of the tongue, throat, or face is a warning sign that should never be ignored. Now let's move on to number 8, one of the most important hidden risks, because it's something many people encounter every day without realizing it. If you're taking losartan or lisinopril, potassium levels matter more than you may think. When most people hear that potassium is important, they immediately think, that's not a problem for me. I don't take potassium supplements, but that's where many people get caught off guard. Potassium isn't only found in supplement bottles, it's hidden in places people rarely suspect. Salt substitutes, electrolyte mixes, meal replacement shakes, heart-friendly seasoning blends, and many over-the-counter products can contain significant amounts of potassium. Both losartan and lisinopril can increase potassium levels in the body. The concern is that excessive potassium can interfere with the electrical signals that control your heartbeat. The dangerous part is that elevated potassium doesn't always create obvious warning signs. Some people experience muscle weakness, cramping, unusual fatigue, tingling sensations, or heart palpitations. Others may have very few symptoms until levels become dangerously high. Robert's story is a perfect example. At 74, he was determined to improve his health. He reduced his sodium intake, carefully read nutrition labels, and proudly switched to a salt substitute because he believed he was making a smart choice for his heart. What nobody had explained was that many salt substitutes replace sodium with potassium. Without realizing it, Robert was combining losartan, which can already increase potassium levels, with extra potassium added to nearly every meal. Gradually, he started feeling weaker than usual. He felt off balance, low on energy, and occasionally noticed his heart skipping beats. When blood tests were finally performed, his potassium level had risen high enough to require immediate medical attention. The sad reality is that Robert wasn't being reckless. He was trying to do everything right. He followed the advice he thought was best. The problem was simply that nobody connected the pieces for him, and that lack of education is often where preventable problems begin. Now let's move to number 7, a topic that causes enormous confusion among patients. This is the truth about kidney numbers. Many people are surprised to learn that losartan and lisinopril do more than lower blood pressure. For the right patient, they can help protect both the kidneys and the heart over time. However, when someone first starts these medications or has their dose increased, doctors often monitor kidney function through blood tests. Occasionally, those tests show a small increase in creatinine or a slight decrease in eGFR. To many patients, seeing those numbers change feels alarming. They immediately assume the medication is harming their kidneys. Sometimes there is a problem, but in many cases, a small initial shift is expected because these medications alter pressure inside the kidney's filtering system. This is exactly why laboratory monitoring is so important. Sharon nearly made a serious mistake because she misunderstood this process. At 71, she had both high blood pressure and early-stage kidney disease. Her physician prescribed lisinopril partly because of its protective effects on the kidneys. A few weeks later, routine blood work showed a small change in her kidney function numbers. Before anyone could explain the results, Sharon saw them online through her patient portal. She panicked. Convinced the medication was damaging her kidneys, she came very close to stopping it on her own. When we spoke later, I explained that the most important question isn't simply whether a number changed. What matters is how much it changed, how quickly it changed, what the overall trend looks like, and what else is happening throughout the body. A small expected adjustment that occurs under medical supervision is completely different from a serious decline in kidney function. That's why follow-up testing isn't just a formality, it's an essential part of treatment. These medications can be extremely effective and protective, but they work best when they're monitored properly and interpreted in the right context. That brings us directly to number 6, one of the most overlooked risks for older adults. Dehydration changes everything. If you're taking losartan or lisinopril and then develop vomiting, diarrhea, a stomach infection, poor appetite, excessive sweating, or any condition that causes significant fluid loss, your body's response to medication can change dramatically. The same dose that was helping you yesterday may affect you very differently today. Blood pressure can drop too low. The kidneys can become stressed. You may experience weakness, dizziness, lightheadedness, or even fainting. In some situations, acute kidney problems can develop surprisingly fast. The medication itself hasn't changed. What changed is your body's fluid balance. Unfortunately, many people continue taking their medication exactly the same way during illnesses that significantly alter hydration levels. Frank learned this lesson the hard way. At 78, he developed a severe stomach virus and struggled to keep food or fluids down. Despite feeling miserable, he continued taking his regular losartan every morning because he believed missing medication was always the wrong choice. One evening, he stood up from his chair and nearly collapsed as the room suddenly started spinning. When he arrived at the emergency department, doctors discovered that the issue wasn't the medication itself. The problem was severe dehydration. His blood pressure had dropped dramatically, and his kidneys were under significant stress. What Frank needed wasn't blind dedication to a medication schedule. He needed guidance about managing medication during illness. He needed a plan for sick days and an understanding of when dehydration changes the rules. Advice like this may not sound dramatic, but it prevents real suffering and helps people avoid dangerous complications. Now let's talk about number 5, a risk hiding in countless medicine cabinets. Surprisingly, it doesn't begin with prescription medication.